Hello, this is Troy Thompson. I'm a coding educator for the Specialty Pods. Today I will be going over Gynecology OB with the ICD-10 2016 updates. The Centers for Medicare and Medicaid Services allowed a one-year grace period for unspecified codes during the inaugural year of ICD-10. However, that year is up, and CMS will now expect physicians to document and code with high levels of specificity for conditions that fall within their specialty. Although still allowed, the use of unspecified codes should be rare, and most unspecified codes should fall outside the physician's area of expertise. For all claims with dates of service on or after October the 1st, 2016, you must use the updated ICD-10 codes. If you do not, CMS will reject all claims using the old codes and your practice will not get paid. For commercial payers, some may take longer to update codes. This could result in claim denials and payment delays of a month or more. What can you do to help? Document to the highest level of specificity. Keep the problem list in EMA up to date. Go ahead and add new codes when appropriate and remove duplicate or conflicting and incorrect diagnoses when possible. Remember that probable and suspected conditions should be reported as signs and symptoms until a definitive diagnosis is made. The updates are as follows. Disorders of the breast was expanded. Disorders of the ovary and fallopian tube. For most ovarian and fallopian tube codes that did not previously include laterality, the new codes have been added for right, character of 1, and left, character of 2. The unspecified code has a character of 0 or 9. But remember, we're trying to limit our use of the 0 or the 9. Female genital prolapse indicate the first, second, or third degree prolapse. Specify the type and laterality. For hypertrophy of the vulva, it was expanded to include 3 additional codes. For dyspareunia, previously indicated with only 1 code, but new codes have been added to include superficial, deep, other, and unspecified. Post-procedural complications. For post-procedural hemorrhage, hematomas, and seromas, all of which were previously reported with 1 code, has now been separated into their own individual codes. Congenital anomalies have been added to include type and laterality. Complications for mesh implants and prosthetic device, previously included in codes for complications associated with other prosthetic implant materials, implant mesh has separated into their own codes. We have encounters for contraceptive management. Codes have been added for a visit that prescribes the different type of contraceptions available for use. These codes are for initial and surveillance. There are also other static new codes that were listed. Antepartum, first, second, and third trimesters. Intrapartum and postpartum periods of a pregnancy have been added too. Included in these changes are the addition of the terminology of without intrauterine pregnancy and with intrauterine pregnancy to abdominal pregnancies such as pregnancies, tubal, ovarian, other ectopic, and unspecified ectopic. Supervision of pregnancy with history of ectopic or molar pregnancies have been removed from the description and separate codes have been established for molar pregnancies. We also have changes to hypertension, pre-existing hypertension, gestational edema, and such. These codes have now consists of a fifth character. A fourth is for childbirth and fifth is for after delivery. For eclampsia codes, the word "in" has been replaced with complicating. Gestational diabetes, new codes have been added to indicate when gestational diabetes is controlled by oral hypoglycemic drugs during pregnancy, childbirth, or after. For maternal care for disproportion due to other fetal deformities, they have been expanded to include a seventh character, 0 through 5 and 9. Maternal care for scar from previous cesarean delivery has been expanded into 3 codes to indicate the different types of cesarean sections that may have been performed. For placenta previa, previous codes exist for non-specific placenta previa and have been revised to include complete and NOS or without hemorrhage or with hemorrhage. New codes have been added for partial placenta previa and low-lying placenta to identify with or without hemorrhage and include the trimester. 3. Third-degree perineal laceration during delivery has been expanded to identify the different degrees of third-degree lacerations that may occur. There are also a numerous amount of deleted GYN codes that I just went ahead and included so you can take a quick glance at those. And there were also deleted codes for OB, which I included as a quick glance reference for you. So that's it, and thank you very much. If there are any additional questions, please feel free to reach out to me. We will also be sending over a tip sheet that should also assist in the new ICD-10 updates. Thank you again.